All right, everyone, and welcome back to Anatomy 1. In this lesson, we will study the thigh and the superficial aspect of the anterior part of the thigh. In the next lesson, we'll be learning about the medial as well as the posterior part of the thigh. All right, so in this lesson, we will have an intro to the thigh part of the lower limb. We'll be finding out some superficial parts of the thigh, such as the fascia, the femoral sheath, the femoral canal and ring, which comes in very, very much handy when we are discussing, for example, the phenomenon of femoral hernia. Then we will be talking about the veins of the the veins of the thigh, including the superficial veins and the deep veins and how important the deep veins are. And then we'll be talking about the inguinal lymph nodes, and that's all going to be for the superficial parts of the thigh. And then after that, we'll go into the first compartment of the thigh, which is the anterior thigh. We'll be talking about the skeletal framework of this region, as well as the muscles, the blood vessels, the nerves, and as well as the femoral triangle and the adductor canal, which are going to be very important spaces in this region. Okay, so the thigh, right? So the thigh anteriorly is the region between the hip joint and the knee joint. So you can think of it anteriorly as this region right here. All right, in between the hip, which is right here, and the knee joint, which is right here. On the back, on the posterior side, however, the thigh will begin around here. Why? Because on the posterior side, we have the gluteus region, the gluteal region right here, which we have already learned about. And the gluteal region only exists at the posterior side, and therefore, on the posterior side, you need to superiorly have this gluteal region before you go down, and it becomes the thigh down here. Okay. Now, posteriorly, as we have said before, the thigh is continuous with the gluteal region up here, and anteriorly, it communicates with abdominal cavity because anteriorly, there is no gluteal region. Okay. Now, on this anterior side right here, there are structures that passes from the abdominal cavity to the anterior thigh. And there are structures that pass from the thigh back to the abdominal cavity. Okay. So more specifically, the artery, okay, like for example, over here, you have the external iliac artery is going to pass through this boundary between the abdominal cavity and the anterior thigh right here, which is the inguinal ligament. After it passes through the inguinal ligament, it will become the femoral artery. Okay, so now the femoral vein is going to go up here, right, like that, and then it passes through the inguinal ligament to go back into the abdominal cavity. When it does so, it becomes the external iliac vein. Okay, so there are multiple vessels like that, as well as some lymphatic vessels that travel back and forth like that. And so we will talk about them more when we explore the different regions of the thigh. Okay, so now let's go to the superficial parts of the thigh, and we will learn about the fascia, the femoral sheath, the femoral canal and the ring, as well as the veins and the inguinal lymph nodes. Okay, so for the fascia, you got several types of fascia in the thigh. The first one is the superficial fascia. This superficial fascia lies deep to the skin and consists of loose connective tissue. Why? Because essentially, if you think about it, the superficial fascia is basically the hypodermis level of your skin, basically. Actually, it's not really a part of the skin, but usually it is studied in conjunction with the skin. You know, you have the epidermis on top, okay, and then you have a connective tissue layer, okay, which is the dermis, and then after that you have a layer down even deeper than that. That is the hypodermis or subcutaneous layer, and that is what the superficial fascia is. Now, the superficial fascia of the thigh is differentiated into two layers: the superficial fatty layer and the deep membranous layer. Okay. Now, the deep membranous layer is going to be continuous with that of the anterior abdominal wall, and it is attached to the deep fascia, which is called the fascia lata, okay, about 1 finger breadth below the inguinal ligament. Now, the deep fascia is actually important here because it has a name. It's going to encase all of the thigh. Okay, so if you can think about it, it's like a layer of fascia that is more deeper than the superficial layer of fascia and encase the thigh in its entirety. Okay, from the anterior side to the medial side to the posterior side and back up to the anterior side. Okay, so the deep fascia of the thigh is called the fascia lata, and there will be a muscle that tenses this muscle. And there will be a muscle that tenses this fascia. So we call that muscle the tensor fascia lata. Okay. Now, this fascia is going to cover all of the thigh, but on the lateral side, which is this side right here, and as you can see over here on the lateral view of the thigh, the fascia lata thickens to form this very, very strong band. You see that? That extends all the way down here and inserts to the lateral side of the tibia. This is what is known as the iliotibial tract. Why? Because it runs from the iliac crest over here all the way to the tibia. So therefore, iliotibial tract, IT tract or IT band. All right. Okay. So the fascia lata are going to be this fascia that runs all the way surrounding the thigh like this. Okay. You can see it right here in an artist's rendition of the thigh. Now, neurovascular components, like for example, the superficial veins, is going to have to pierce this deep fascia to get inside. Okay, like for example, this great saphenous vein is going to have to pierce that fascia to get into the femoral vein right here. Otherwise, the nerves, like for example, the anterior femoral cutaneous nerves, as well as the lateral cutaneous nerve of the thigh and the medial cutaneous nerve of the thigh, they're all going to have to pierce that fascia here, 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 or here in order to get all the way down to the thigh. Okay. Now, for the saphenous opening is basically just a gap in the deep fascia here, where the great saphenous vein is going to go in, okay, in order to join with the femoral vein, like in this view you can see. Okay, the femoral vein is this deep vein right here, and the superficial vein, which is the great saphenous vein, will have to find a way in order to get back and dump its blood, its venous blood, into the femoral vein, right? And this hole, okay, the saphenous opening is going to be the way that it does that. Okay, there is another name for the saphenous opening, and we will learn about that when we talk about the inguinal, about the femoral ring. I'm sorry, when we learn about the femoral ring, that will coming up shortly. All right, there it is. Talk about the devil. So now we'll talk about this thing called the femoral sheath, and more specifically, we'll talk about a very, very important component of the femoral sheath, which is right here, the femoral ring. Okay, but let's go on to the femoral sheath first. Now, as you can see right here, the femoral sheath, if you can imagine it, is this part right here of the fascia, of the deep fascia right here, right? That follows the vessels, the artery, the femoral vein, okay, down here, all the way into the thigh region. Okay, so see this. This part here is called the iliacus fascia, right? Right here, when it accommodates this is the external iliac artery and this external iliac vein, as well as a whole bunch of lymph nodes right here, in order to pass from the abdominal cavity into the thigh, right? There will be 3 holes. Okay, one hole is going to be accommodating the artery, one is going to be accommodating the vein, and one hole right here, the femoral ring, is going to accommodate the lymphatic vessels and nodes, right? And so these things don't just form these holes right here, but if you can imagine it, the fascia kind of just extends down a little bit with the vessels, okay, that they travel as well. So imagine that the fascia goes down like this, right, and cover these components, okay, and it covers these components like that before it goes back up again. So it covers that like kind of like a shorts, a pair, like, you know, this is a part of the pair of shorts basically, okay, that covers this artery here, the external iliac artery, the external iliac vein, as well as all of these lymph nodes here as it's traveled down the thigh and becomes the femoral artery, the femoral vein, and lymph nodes and lymphatic vessels down here. Okay, so that's what the femoral sheath is. And there are three main compartments. Okay, the femoral artery occupies the lateral compartment, which is this compartment right here. Okay, of the femoral sheath. Okay, the medial compartment. The femoral vein. The femoral vein is going to be the one that occupies the middle compartment, right? And then finally, the lymph nodes right here is going to occupy the medial compartment right here. So there are three compartments. Now, arteries and veins are very solid and they are very tangible, which means that it's very hard to displace them. Okay, like for example, if you have intestines over here, okay, inside the abdominal cavity, and it wants to go through this way, it cannot do that because of the fact that there is a huge artery right here. Artery is tangible, you can't displace it. Similarly with veins, if it wants to go through here, it cannot do that either because veins is tangible. It's a very, very big structure and it goes through here. But if the intestines want to go through here, oh, now we have a problem. Why? Because of the fact that in this femoral ring over here, what goes through the femoral ring? Only a handful of lymphatic vessels, which are small, as well as lymphatic nodes, which are also small. And so because of that, it can go through here. And if there's an increase in abdominal pressure, like for example, okay, when you are old, okay, when you get older and when you accumulate a whole bunch of visceral fat within your abdominal cavity, then the intestine has the potential to go through this femoral ring and end up here. What do we call that? We call that femoral hernia. Okay, we call that femoral hernia. And this is what it looks like. For example, when you have all of these things, okay, all of these intestines right here on the abdominal cavity, and there is basically a pressure that is applied into the intestines over here, it will push the intestines, and sometimes the push is strong enough that the intestines can get down, okay, into this medial compartment, the femoral, through the femoral ring into the medial compartment of the femoral sheath and stay down here. This is what is known as the femoral hernia, okay, and this is also one type of hernia that is frequently encountered, especially in women, in the female, okay. In the male, usually it is going to be the inguinal canal that is compromised and you got inguinal hernia. But in female, usually it will be the femoral ring that abdominal contents is going to be pushed through. And therefore, the female condition, okay, of hernia is most likely going to be femoral hernia. All right. Okay, now let us go over the fascial compartments of the thigh. Okay, so these compartments are extremely important for you to know. Why is that? Because if you remember these components as well as what muscles are within each component, right, you will remember not only their function, but also their nerve supply. Okay, and why is that? Let me explain to you. Now, remember the fascia lata that we have already spoken before, right? Which encircles the thigh like this. Now, the fascia lata is going to give off some of this fascia to go and attach to more deeper components. Like over here, it attaches to the femur right here. And these fascial components are going to divide the thigh into three compartments. This is compartment number one, which is anterior compartment. And the muscles of these anterior compartment does two things. It flexes, some of them will flex the hip joint, and some of them will extend the knee joint. Okay, so flexes hip, extends knee. Which one does which? We will know when we talk about them in the anterior thigh coming up shortly. Okay, and one more thing. The anterior compartment is all supplied by this one nerve, femoral nerve. Okay, the femoral nerve is the main nerve that supplies all of the muscles in the anterior compartment. Very important stuff that you have to understand. Okay, now the posterior compartment, what does it do? Posterior compartment is going to have the opposite action to the anterior compartment. It's either extend the hip or actually may not be extending the hip. I'm sorry about that. Extending the hip is more of the gluteal compartment, which is also like superior to the posterior thigh. Okay, so not extend the hip, but flexes the knee. So the main action of this compartment is the flexion of the knee. Okay, and what nerve is going to go into here and supply this compartment? A very big nerve, the biggest nerve in the human body, aka the sciatic nerve. And more specifically, it's going to be mostly the tibial component of the sciatic nerve that goes into supplying all the muscles of the posterior compartment of the thigh. Now, the medial compartment of the thigh is going to do what? Adduction. Okay, so it's going to adduct the hip. Adduct the hip. And the nerve that goes into here and supplies this medial compartment is going to be the obturator nerve. Obturator nerve is the nerve of the adductors. Okay, this is the way that I remember. Okay, the medial compartment contains all the adductors, and therefore the obturator nerve has to be the nerve that is going to do that. Okay, very important stuff, and you need to know this. Okay, and if you know this, it will make learning these compartments and the muscles in there much easier. All right, how about the veins of the lower limb? The veins of the lower limb are going to be divided into 3 groups. Okay, and those 3 groups are going to be superficial veins, deep veins, and perforating veins. Now, the superficial veins are the ones that run superficial. They run within the superficial fascia. Okay, what does that mean? Remember when we talk about the superfascia of the thigh, right? And how this is a loose connective tissue and there's a whole bunch of fat in it? It's basically the hypodermis of the skin. Yes, these superficial veins are the ones that runs within that fatty layer, okay, the superficial fascia. Okay, and there are 2 main superficial veins that you need to know. Those are going to be the great saphenous vein, okay, as well as the lesser saphenous vein. Those 2 you need to know, okay? Now, for the deep veins run deep within the lower limb, okay? They usually runs in between the muscles, okay? And the deep veins right here, simply because of the fact that there are muscles all surrounding them, okay? As when it comes to, like, you know, for example, the leg portion, okay, of the lower limb, these muscles, if you move the leg, these muscles can compress the vein, the deep vein, to send blood from the extremity all the way back into the body and back to the heart easier. Okay, this is a very, very important phenomenon, especially if you're talking about, for example, when you don't do this for too long and blood stagnate at the deep veins of the leg. And when blood stagnate, it has the potential to clot, causing the clot to form within the deep veins. We call that deep venous thrombosis, or DVT. And that is a very, very major problem if you are going on a very, very long plane ride. Okay, like for example, I used to go on like 20-hour plane rides from here to the United States of America. Okay, and so on those flights, I left my deep veins and my muscles, my deep muscles of the leg, for example, relaxed quite a bit and not moving them quite a bit. Okay, so I am a younger guy, so that's okay. But imagine somebody who's like 60 years old, right? Those clots are going to form, and it will travel all the way to the heart. Okay, all the way to your right atrium, then it goes down to your right ventricle, going to be pushed over to the pulmonary artery, going into the pulmonary vessels, and they are going to get stuck over there on the pulmonary vessels and causing all sorts of bad shit. Okay, and so because of that, okay, deep venous thrombosis is something that is very, very important, and it's a very important correlate when you learn about the deep veins in this region. Okay, so that's the deep veins. And so the deep veins usually are going to accompany the arteries, because arteries will run deep, right? So you have veins such as tibial veins, okay, the anterior tibial veins, posterior tibial veins. You have the femoral vein, okay, and those are going to be deep veins. And now, in between the superficial veins and deep veins, there are these veins right here. You see them? Right here and or right here. And those guys are going to be communicating veins. Okay, so just like their name implies, communication veins will communicate in between the superficial veins and the deep veins. Now, let's talk about superficial veins. Okay, we'll talk about some of the deep veins in the body later when we learn about these components. Okay, like for example, in the thigh, we'll learn about the femoral vein. Okay, in the leg, we'll learn about the anterior tibial and posterior tibial and fibular veins. But right here, let's talk about the superficial veins right now. Now, the superficial veins are going to be two of them. Okay, very, very important two that you need to know: great saphenous vein, okay, and the lesser saphenous vein. Let's talk about the great saphenous vein first. Okay, so the dorsal venous arch is this common venous arch right here. That the small saphenous vein right here and the great saphenous vein right here, they all originate from that. Remember, when we talk about veins, we don't talk about the flow as if it's going into the extremities like this. No, it's not the way to talk about veins. Veins bring blood from the extremities back into the body and back to the heart, right? Therefore, we need to describe the vein as if they are starting from somewhere distal and then run and then run proximally towards the body and towards the heart, right? And therefore, we can all describe this, the dorsal venous arch, as the origin of both of the great saphenous vein as well as the small saphenous vein. Now, look what happens, right? From the dorsal venous arch, what happened? From the dorsal venous arch, the dorsal venous arch courses medially and give rise to the great saphenous vein on the medial side of the leg. Okay, this is the leg right here. And therefore, the medial side of the leg is where the great saphenous vein starts. The great saphenous vein is going to course on the medial side of the leg. And when it reaches the medial malleolus right here, it will go anterior to the medial malleolus. Okay, so remember this. This is very important. Get tested all the time. The great saphenous vein is going to course anterior to the medial malleolus as it goes up here. That's great saphenous vein. Now, how about lesser saphenous vein? The lesser saphenous vein starts on the lateral side of this dorsal venous arch right here. Okay, and the small saphenous vein is going to course posterior to the lateral malleolus. Okay, so small saphenous vein, once again, posterior to the lateral malleolus, and then it goes up to the posterior side of the leg. Okay, up here, the great saphenous vein is going to be on the medial side of the leg, but the small saphenous vein is going to be on the posterior side, okay, of the leg. Very important stuff. All right, so the great saphenous vein, right? Great saphenous vein is the longest vein in the body because it travels all the way from here up to here when it joins up with the femoral vein. Okay, now the great saphenous vein is the longest vein in the body, which begins as a continuation of the medial end of the dorsal venous arch of the foot, just like we said before. Okay, and when it goes over here, it will go anterior to the medial malleolus and runs on the medial side of the medial side of the leg like this, and then it will course proximally and superiorly. Okay, and it will run up here at the medial side of the thigh, all the way until here, until this saphenous opening, also called the fossa ovalis over here, when it joins with the femoral vein. Okay, that's why there is a need for an opening over here of the deep fascia, the fascia lata. Because why? Because the vein, the superficial vein, right here, the great saphenous vein, it will need to join the deeper vein right here, which is the femoral vein. And therefore, that's why this opening exists, right? And right here, what you can see is that this is going to be the great saphenous vein as it courses proximally and superiorly upward, right? Now, on the course of it going upward like this, it is going to give out some out some branches like this. Okay, and some of those branches will go deep, like this branch over here, and communicate with these deeper veins over here. Okay, and so what are those veins called again? Those are going to be communication veins. Okay, this is going to be a superficial vein, and that is going to be a deep vein. Okay, so now I think this is a perfect time to talk about the importance of deep veins and deep veins and superficial veins in transporting blood back to the heart. Now, as we have talked about the superficial vein, okay, and the deep veins in the upper limb and lower limb. On the upper limb, superficial veins, we have what? We have the cephalic vein, okay, we have the basilic vein, and for the deep veins, we have, for example, the radial veins, okay, the ulnar veins, the brachial veins, the axillary vein, okay, and those are deep veins on the upper limb. What did we say? Which ones are more important in the upper limb of transporting blood back to the heart? Superficial veins. Yes, that's exactly correct. The superficial veins are the ones that transport blood primarily back to the heart on the upper limb. How about the lower limb? The lower limb is actually the opposite story. Okay, the superficial veins on the lower limb does not transport the majority of blood back to the heart. It is the deep veins that are important as the main method of transport back to the heart. Okay, the great method of venous return in the lower limb is going to be the deep veins. Okay, and therefore, if you have a deep vein thrombosis, for example, it's going to be a huge lot of trouble because those thrombi are going to go all the way from the lower limb back to your right atrium, right ventricle, and then going to your lungs and heartbeat. Okay, this is the major venous return of the lower limb, which is very important. Okay, so there are many tributaries of the great saphenous vein. Okay, like for example over here, especially near the fossa ovalis or the saphenous opening right here, you see there's a whole bunch of tributaries. Okay, whole bunch of tributaries over here, and some of those tributaries you can name are going to be either the superficial circumflex iliac vein, which is right here. Okay, and you also have the superficial external pudendal vein, which is right here, going into the skin, the scrotum. And then you have the superficial epigastric vein, which actually collects venous blood from the superficial part of the inferior abdominal wall. Interesting, right? These tributaries come from different paths. Okay, one coming from the lateral part of the hip, one coming from actually the scrotum down here, or the labia majora in the female. And then right here, it comes from the abdominal wall. But they all goes into, the great saphenous vein like this before the great saphenous vein go into the femoral vein. Okay, the accessory vein sometimes you can see there is something that is called the accessory saphenous vein, as drawn out here by Netter. Okay, and this accessory vein usually join the main vein around the middle of the thigh or higher up at the saphenous opening. So it can join right here or way high up right here. All right. So now inguinal lymph nodes. Inguinal lymph nodes are going to be divided into the superficial and deep groups. Now, for the superficial nodes, there are the horizontal group. Okay, they are the horizontal group, and they are the vertical groups. Okay, now the horizontal group lies just below and parallel to the inguinal ligament. Where is the inguinal ligament? Just right here. And so, where are these nodes located? They're right here. They are the horizontal group. Okay. Now, where's the vertical group? The vertical group is going to lie along the terminal path of the great saphenous vein and receive most of the superficial lymph vessels from the lower limb. Okay. Vertical groups, this one. And if you look very, very carefully, they form a T. So the superficial nodes have the vertical groups and the horizontal group, and they form a T with each other. Now, the deep inguinal lymph nodes are around here. Okay, the deep inguinal lymph nodes are located between the deep fascia and lies along the medial side of the femoral vein. The efferent vessels from these nodes enter the abdomen by passing through the femoral canal to lymph nodes along the external iliac artery. So they don't even have anything to do with the superficial lymph nodes at all because they lie one layer deeper and they pass through where? Remember the inguinal ring? The femoral ring that we have talked about? The femoral ring, they pass through the femoral ring right here, and then they pass into the abdomen. Okay. Now, these guys, the deep inguinal nodes, they receive the lymph from deep lymph vessels, the efferents, the proper two nodes, that accompany the femoral vessels and form the glans penis or glans clitoris, okay, which is all the way in here. All right. Let's go to the anterior thigh. All right. So now let us go to the anterior thigh now. And there are some topics that we are going to cover in the anterior thigh. We're going to cover, once again, the skeletal framework of the thigh. Then we are going to cover the muscles of the anterior thigh, and then the blood vessels, the nerves, and then two very important spaces in this region, the femoral triangle and adductor canal. All right, so the skeletal framework of the anterior thigh, and indeed the whole thigh in general, is the femur. Now, the anterior thigh is supported by the anterior surface of the femur, which is this surface right here. Okay. Now, the posterior thigh is going to be supported consequently by the posterior surface of the femur, as you can see here. Okay. All right. And don't forget that right here we have the patellar surface that the patella is going to articulate with. And before we go any further, I think it is appropriate to tell you once again that the greater trochanter and lesser trochanter are insertion points of very, very important muscles. Okay, so now let's go to the muscles of the anterior thigh. The anterior compartment of the thigh contains some muscles that you will have to know. Number one is going to be the pectineus muscle right here. Okay, and then after that, you have this very, very long muscle right here that is called the sartorius muscle. Okay, this muscle is going to originate way up here on the anterior superior iliac spine and run all the way down here to the medial surface of the tibia. Okay, and so that sartorius is the longest muscle in the body. And then we have this huge complex of muscle right here. Okay, this huge complex right here. And this huge complex actually contains 4 different muscles. Okay, you can see 3 of them right here on the superficial surface of the anterior thigh. And then if you take off this muscle in the middle right here, you take this one off, you will see that there is one more deeper to it down here. Okay, and those 4 muscles are going to be here. You have the rectus femoris. That is the middle muscle, but more superficial than the deep one. Okay, then you will have this one here, which is the vastus medialis muscle right here. Okay, vastus medialis muscle. Then the reverse of that is right here, which is the vastus lateralis muscle. And if you take off the rectus femoris muscle, you will see that there is a muscle that is the vastus intermedius that is right deeper to the rectus femoris muscle right here. And all 4 of these muscles, the rectus femoris, the vastus medialis, the vastus lateralis, and the vastus intermedius, they all converge into this tendon right here. You see that? And that tendon right there is the quadriceps tendon, the tendon of the quadriceps femoris muscle. And the tendon of the quadriceps femoris muscle has the property of going down and insert partly into the patella before going through the patella, making the patella an entire bone that is contained within the quadriceps tendon. And the quadriceps tendon is going to go from the patella then to the tibial tuberosity at the anterior surface of the tibia right here. And so this portion here is going to be called the patella ligament. Okay, in some textbooks, especially earlier textbooks, you will see that they refer to this as patella tendon. But then again, that information is not really correct because this band of connective tissue actually extends from the patella, which is a bone, to the tibial tuberosity, which is another part of another bone. Okay, and so bone-to-bone connection is a ligament, not a tendon, and therefore they changed the names to patella ligament rather than patella tendon. Okay, all right. So then after that, you also have this very, very important muscle right here, okay, that we forgot to mention over here. And this important muscle here actually come all the way from the abdominal cavity and is the product of the fusion of two muscles. The psoas major muscle, that is the more medial one, and the more lateral iliacus muscle. And they all goes down through the inguinal ligament right here in order to make the iliopsoas muscle. That is right here. The iliopsoas is the product of both of these guys right here. And it will insert onto the lesser trochanter of the femur. And this muscle here, the iliopsoas, is important because it is the prime flexor of the thigh. Okay, the thigh is flexed at the hip joint because of the fact that the iliopsoas contracts alongside with some other muscles that helps it in this motion. Now, a major point that you have to remember is that all anterior thigh muscles are going to be innervated by which nerve that we have just learned? The femoral nerve. Very good. All right, so this is a more of a close-up of the iliopsoas muscle and the constituents on the abdominal cavity. Okay, you see right here. On the abdominal cavity, we'll have the psoas major muscle, which is the more medial muscle. Okay, and then you have the iliacus muscle, which is named because it originates over here. Okay, on the iliac crest, and therefore iliacus. And then the iliacus and the psoas major continues downward, passing through the inguinal ligament in order to become the iliopsoas muscle. And finally, the iliopsoas muscle is going to insert to the lesser trochanter. And this muscle is very important because it is the prime flexor of the hip joint flexor of the thigh at the hip joint. Okay, and this is all of the information that you need in terms of muscles. Once again, I will not go over every single one of these muscles, but you guys just need to know that the anterior compartment muscles, what do they do? Flexes the hip joint, okay, and extend the knee joint. Okay, flexes the hip joint and extend the knee joint. Okay, so because of that, you will have this compartment muscles, if you go through their function, flexes the hip, extend the knee joint. Now, which one flexes the hip and which one extend the knee? And why do they flexes the hip or extend the knee? I'll get you to do that, okay, on your free time later on. Now, remember, all of these guys, okay, all of these guys are going to be innervated by branches from the femoral nerve. Okay, even this guy, the psoas major, the anterior rami of L1, L2, L3, eventually L2, L3 is going to make up a part of the femoral nerve as well. So you can also think of the psoas major as partially innervated by the femoral nerve. But actually, because the psoas major is so high up over here, okay, the nerves that is going to supply it is precisely actually have to be anterior rami of L1, L2, L3. Okay. All right, so the blood vessels of the anterior thigh is going to be the femoral artery and its main branch, the deep femoral artery. So now let's just go over the femoral artery a little bit as it extends down. The femoral artery begins as the external iliac artery up here. And the external iliac artery is going to go through the inguinal ligament right here. And when it goes through the inguinal ligament, it becomes the femoral artery. And the femoral artery will give off some branches, 4 side branches first, actually. This one, this one, this one, and this one. Okay. You have the superficial external iliac artery, okay, which is right here. And then you have the superficial epigastric artery right here. And you have the superficial and deep external pudendal artery that goes to the scrotum right here. Remember, guys, these superficial arteries, what they do is they simply supply the skin region whatever place they go to. So, for example, the superficial epigastric artery is going to go over here to the abdominal wall, and it supplies what? The blood supply for the anterior surface of the anterior abdominal wall, right? The skin of the anterior abdominal wall, basically. Okay. And for these guys, the superficial external pudendal and deep external pudendal, they supply the skin of the scrotum, which is in here. All right. Now, as the femoral artery descends down to this, okay, it is going to travel in what is known over here as the femoral triangle, okay, and it will travel in the femoral triangle with the femoral vein and the femoral nerve, as well as some lymphatics, okay. So now it's going to run down here, and when it gets out of the femoral triangle over here, it will run in the adductor canal, okay. This is the path where it runs in the adductor canal before it goes through this hole right here, the adductor hiatus. The adductor hiatus is going to make the femoral artery go through it, and when it goes through it, the femoral artery is going to change from the anterior to the posterior surface of the thigh, okay, and enter the popliteal fossa that is on the posterior side, okay. And when it does that, it changes name again to the popliteal artery, okay. Okay, and now as it goes through here, just like I said before, it gives off this branch here, okay. This branch is a major branch of the femoral artery, okay. This is called the deep femoral artery, or the deep artery of the thigh, or there's another name which is the profunda femoris artery, okay. So all those three names mean the same thing. It is the deep artery of the thigh, okay, deep femoral artery. And the deep femoral artery is significant because the deep femoral artery is the main blood supply of all of the muscles in the thigh, okay, in the anterior thigh especially, okay. So the deep femoral artery is very important because of this, okay. It is the blood supply, the main blood supply of all of the muscles of the thigh, and the anterior thigh especially, okay. And all of these is just basically the things that we have said before, okay. Here you see another good picture, okay, of the things that I told you before, okay. This one here, okay, is the main branch out from the femoral artery, which is the deep femoral artery. And when you have the deep femoral artery, it goes to supply the deeper structures, including the muscles, via these perforating branches, okay, as well as these muscular branches right here. And then after that, you have like this branch right here that also branches out from the deep femoral artery, which is this one is the ascending branch of the lateral circumflex femoral artery. This one is the transverse branch of the lateral circumflex femoral artery. And finally, this branch goes down, which is the descending branch. And the descending branch, the reason why it's important is that it goes down here and participates in the anastomosis that supplies the knee joint, okay. And so this is very important because it helps nourish the knee joint. And now the transverse branch is the one that goes around, okay, this portion, the proximal portion of the shaft of the femur, okay. The way that it runs should remind you of the humeral circumflex, the anterior humeral circumflex artery, because this is equal, okay, here down in the lower limb, okay. And also the ascending branch right here, the way that is important is that it gives off the branch here, okay, that travels up the neck over to the head of the femur. And this becomes very, very important simply because of the fact that if you have a fracture of the neck of femur, okay, fracture of the neck of femur very often happens, especially in elderly women, okay, the ones that has already gotten through menopause, they no longer secrete estrogen, and therefore there is a disbalance between bone formation, which decreases, and bone destruction, which increases. And because there is an increase in bone destruction, they usually have what is known as osteoporosis, which is their bone becomes porous because their mineralization is going to be decreased. There's less calcium and phosphate in those bones, and they are easy to break. And this area is one of the most often broken parts when they have osteoporosis, basically. So fracture of the neck of the femur, extremely easy thing that you can see clinically, okay? And when this fractures, look at all of these blood supply. They will no longer have these blood supply anymore, okay? Because it is fractured right here. The blood vessels are going to be torn off. And so because of that, what ends up easy to be necrotized? This part right here, okay? The proximal part of the neck of the femur and the head of the femur. It's just very, very easy necrotize. The head of the femur has two blood supplies. One is this. The other one comes from the artery that runs within the ligamentum teres of the head of the femur. Okay, but this blood supply is puny. It cannot supply the whole head of the femur with this, and therefore, if you have the fractured neck of femur, it is very, very easy that these parts right here becomes very easily necrotized because of that. Okay, this is very important. All right, so this is all of the things that we have talked about before. The profunda femoris, okay, profunda femoris or the deep femoral artery is very important simply because of the fact that it supplies all of the muscle of the thigh, okay, especially the anterior thigh. Okay. All right, so now let's go to veins. Veins, we have the femoral vein. Okay, the femoral vein is going to just run parallel to the femoral artery. Okay, but how will it run? It will run a little bit more medial to the femoral artery over here on the proximal part of the anterior thigh. However, on the distal part of the anterior thigh, the veins and the artery will switch places. Okay, and we will talk about that a little bit more when we talk about the femoral triangle and the adductor canal later on. But now, femoral vein, what are the main tributaries of the femoral vein? The femoral vein, okay, is going to receive tributaries. These two tributaries are the most important. The great saphenous vein over here, which go into the femoral vein at the saphenous opening up here, and the profunda femoris veins, which go into here. All right. And some tributaries of the femoral vein are going to, some other tributaries of the femoral vein can be the muscular branches along its length, okay? And the lateral and medial circumflex femoral veins are also usually tributaries of the femoral vein as well, okay? And when the femoral vein going up here and passes through the inguinal ligament right here, it will become the external iliac vein right here. All right? All right. Now, femoral nerve. What is important about the femoral nerve, guys? It is the one that is going to innervate every muscle of the anterior thigh. Okay. Now, if you're being picky about it, okay, the psoas major muscle is going to be innervated by anterior rami of L1, 2, and 3. Okay. But L2 and L3 are going to be going into the formation of the femoral nerve anyway. Okay. And therefore, this muscle on the and also this muscle on the distal side is also innervated by the femoral of the femoral nerve anyway, and therefore you can say that all of these muscles on the anterior compartment is going to be innervated by the femoral nerve. Okay, that's it. All right, and femoral nerve, some side information is that it is the largest branch of the lumbar plexus. Okay, which is going to be L2, L3, and L4. Okay, it's made up of L2, L3, and L4. Now, guys, for the lumbar plexus and the sacral plexus, don't try to draw it out like the brachial plexus. Okay, don't try to draw it out. Just remember the roots. Usually, these will do. Okay, you need to know that the femoral nerve is L2, L3, L4. Okay, and the sciatic nerve is what? Sciatic nerve is going to be L4, 5, S1, 2, 3. Okay, and you need to know that. For example, your exam and, for example, the clinicals, that is going to be on your 3rd, 4th year and whatnot. Okay. Okay, and now you have all the branches and divisions of the femoral nerve here, but they're not really that important. Okay, but the thing that is important is for you to recognize that the femoral nerve is going to terminate around here. Okay, why is that? Because this is the end of the anterior thigh, right? It is the end of the anterior thigh. So now, what does the femoral nerve do? It will travel more superficially onto the skin, okay, and become this nerve right here. And if you notice very carefully, this nerve is going to run parallel to a vein, right? It's going to run parallel to this vein that goes through here. Now, what vein is that? The great saphenous vein. That is correct. And therefore, this nerve is going to be called the saphenous nerve. Okay, saphenous nerve. So the saphenous nerve, what is the saphenous nerve? It is the superficial branch of the femoral nerve. Okay, it is the superficial branch of the femoral nerve that is going to commence just right here as the femoral nerve ends, due to the fact that the whole anterior thigh region ends here. Okay, so that's very important, and you need to know that. Okay, and so the saphenous nerve, what does it innervate? It innervates the skin region surround the course of it. Okay, so that skin region over there, that is going to be innervated by the saphenous nerve. Okay, and therefore the femoral nerve, for motor, it is going to innervate all anterior thigh muscles. For sensory, it's going to innervate this skin region right here via the saphenous nerve. Okay. Okay. This is what we have just said. Okay. One more very, very nice image about the saphenous nerve right here. You can see that the saphenous nerve, as this moment, okay, it pierces the deep fascia, okay, right here. So the deep fascia here is still the fascia lata of the thigh. It pierces the fascia lata, and it's going to run right there alongside of the great saphenous vein, going through here, going down here, and that's the saphenous nerve right there. Okay. Now, cutaneous nerve of the front of the thigh, or the anterior surface of the thigh. There are three major branches, okay, of the cutaneous nerve on the front of the thigh, and some more minor branches. Let's go with the three major branches first. Okay, there is these branches here. The first one, that are collectively called the lateral femoral cutaneous nerve. And just like the name suggests, it's going to innervate the skin region on the lateral surface of the thigh right here. And then you have these anterior femoral cutaneous branches that comes from the femoral nerve. Okay. And this one here is going to innervate the anterior portion of the thigh right here. Okay. And now there is also something that is called the medial cutaneous nerve of the thigh. Okay. Now the medial cutaneous nerve of the thigh, which is also a branch of the femoral nerve, it will supply the medial aspect of the thigh. Okay. Now, even though the medial cutaneous nerve of the thigh only supplies these more like superior portion of the medial thigh, the more inferior portion of the medial thigh is actually going to be supplied by these cutaneous branches of the obturator nerve. Okay, so there are territories right here, and you need to know that there are some nerves that goes in here. It goes in here and create these innervation territories. And now, okay, you have also some smaller branches, like for example, the femoral branch of the genital femoral nerve here, and the ilioinguinal nerve, which is going to innervate the medial part of the thigh, and it's going to be innervating this tiny area just right there. Okay. All right, so now let us go to the two areas that is very important within the thigh, okay, in the anterior thigh, which is the femoral triangle and the adductor canal. And so to give you a brief overview of these spaces, okay, so now you have the inguinal inguinal ligament right here, right? You got a sartorius muscle right here, okay, and you have the adductor longus muscle that is right here, okay. Now, the femoral triangle is going to be defined by three sides. Side number one, the inferior border of the inguinal ligament, which is this one right here. Medial side is the medial margin of the adductor longus, which is this side over here of the adductor longus. And finally, the lateral side is the medial margin of the sartorius muscle. You only need to know these three sides. Okay, we have the, for example, the apex, the base, the floor, the roof, and everything. But really, these three sides, okay, are the ones that you really should need. Okay, now these all other things are for you as a reference. Okay, because the roof overlying fascia lata, what is that? It is this portion right here that basically put a lid. Okay, put a lid onto the femoral triangle. Okay, but as of now, just know these three sides first. Okay, and going into the femoral triangle are three major components: the femoral nerve, the femoral artery, the femoral vein, and some lymphatics, which is the minor component that goes through the femoral triangle. Okay, so now, importantly enough, you will need to know the order of these guys, these components in the femoral triangle. And there is a mnemonic that will help you do that. That mnemonic is from lateral to medial. This is very important, guys, because it goes from lateral to medial right here. Like here, lateral, medial, right? This is lateral, this is medial. And from lateral to medial, you have what? Number one is the nerve, N. Number two is the artery, A. And number three is the vein, that is V. Okay, and therefore you got NAV. NAV is the mnemonic from lateral to medial that is in the femoral triangle. Okay, this is something that you really need to know. Okay, remember that mnemonic and you should be good. All right, now let's go on to the adductor canal. So now let's take another look at this one. The apex of the femoral triangle is right here, and this is where the femoral triangle ends. But the femoral artery, vein, and nerve will have to travel, okay, will have to travel through this femoral triangle to go to other places, right? Okay, and therefore, the femoral artery and vein and a part, okay, because it's not the full femoral nerve anymore, it's just a part of the femoral nerve, is going to go through this apex and enter this tube right here. You see that? And that tube right there, that is the adductor canal. And so the adductor canal is going to be this place right here, okay, that these components, the femoral artery, femoral vein, and some parts of the femoral nerve are going to go through, okay? And so which components are going to be within the adductor canal here? The components of the adductor canal are going to be the femoral artery, okay, the femoral vein, as well as some deep lymph vessels and the saphenous nerve, and the nerve to the vastus medialis, and the terminal part of the obturator nerve. All right. Now, the adductor canal are going to be defined by some boundaries. The anteromedial wall is the sartorius muscle and fascia, which has been taken off in this image, unfortunately. The posterior wall are going to be the adductor longus and magnus, that are going to be here and here. You see that? That is going to be the posterior wall. The lateral wall is going to be this huge muscle right here, which is the vastus medialis muscle. Okay, the vastus medialis is actually the lateral wall of the adductor canal. And so this canal is just right here. Okay, it's through here. This canal is right here. Okay, now, one thing that the contents of the adductor canal do is that in the adductor canal, the femoral artery and the femoral vein will switch places. Remember, when we said that the artery is going to be more lateral to the vein here, right? But then in the adductor canal, they switch places. But then in the adductor canal, they switch places with one another. Okay, and therefore, when the femoral artery and the femoral vein is going to become the popliteal artery and popliteal vein on the posterior side of the knee as it travels through here and down here, okay, the mnemonic from superficial to deep is not going to be NAV anymore. No, sir. It's going to be NVA because these two have switched places, okay? And therefore, it is a very important thing that you remember that the femoral artery and the femoral vein, they switch places within this adductor canal. All right, that is all, you guys, for the superficial parts of the thigh and the anterior thigh. I will also do another lecture with the medial thigh and the posterior thigh, and then we'll post it up as well with this video. Thank you very much for listening, and I will see you in class. Okay, have fun studying.